I recognize the gentleman from Pennsylvania, Dr. Joyce, for his 5 minutes of questioning.
Thank you, Mr. Chairman and Ranking Member, for holding such a critical issue discussion here this morning. Innovation has long been the cornerstone of American medicine. It's how I practiced medicine for 25 years. America has consistently led the world in development of new and innovative therapies and cutting-edge medical devices. However, due to the current payment structure of Medicare, our nation's seniors frequently can be excluded from accessing the newest medical device technology. In fact, this delay in coverage following an FDA approval by CMS has the unfortunate name of the Valley of Death. Dr. Britton, as a doctor and as a scientist, can you speak to the impact on patient care that many of these breakthrough devices can offer? And then can you talk briefly about how the delay in coverage can ultimately affect patient outcome?
No, thank you for the question. As you mentioned, the Valley of Death, we think about this, about it for the company itself. So from all the work of trying to solve an unmet clinical need to ultimately what might be a decade of time to get to FDA authorization. But the reality is, if you're in the Valley of Death, there's no coverage process to get this to actually the patients that need it the most. So that valley is quite significant. In fact, I believe Josh Macker did work on this at Stanford and noted that it's at least 5.5 years on average for coverage after an FDA authorization.
Our lives lost while people wait that 5.5 years.
A huge impact potentially. So being able to actually provide access, and I mentioned this earlier, access, coverage for a physician to make a decision with the patient, risk versus benefit of that therapy, which has been deemed by the FDA to be safe and effective, seems appropriate that we want to provide that access to these seniors.
Dr. Brinton, we've heard from some that CED is a critical component of access to the innovation that you're talking about right now, and from others who actually feel it truly limits all access. Can you talk about the role that you believe CED should play, if any, in CMS coverage decisions?
So I think we're talking about CED done right. And so just to back up, I think there's a significant difference for CED with medical devices than there is for pharmaceuticals, for instance. The challenge with pharmaceuticals is you open the package and compliance is the biggest challenge. With devices, this involves a procedure, which means it gets better over time. People have to train, get the experience, and often there's iterations and improvement in the technology. So I think being able to actually provide access, to patients with having CED provides the time basically to provide the evidence that needed to meet the standards basically of reasonable and necessary. So it's providing that opportunity of time.
Thank you. Also considered in this hearing is legislation to improve access to multi-cancer early detection testing advancements, which can identify dozens of cancer types through a simple blood test, often before there are any symptoms. This technology enables doctors to intervene when treatment can be most effective and least invasive, dramatically improving prospects for successful outcome, with the ultimate goal of treating and curing cancer. Mr. Royce, let me first of all say that you are not a statistic to me. As a doctor, I never treated a patient as a statistic. I'm trained in science, I utilize science, I understand how important numbers can be. But you and your testimony here today has been riveting. Can you speak more on how this testing, specifically early detection, improves outcomes, in your case, and the discussion that didn't occur with your brother, and treatment courses and how that's impacting cancer today?
Well, thank you for that. I appreciate it. Clearly, as I said, the one thing, I had a lot of doctors, I had oncologists, I had surgeons, I had radiologists, and you talk to 3 doctors and you get 5 opinions sometimes, it seems like. But one thing they all did agree on is that my prognosis would have been much, much worse if I had not had this test. And just to reiterate, I did have an annual physical. I thought I was healthy. I was doing everything right. And every year, it's like you have no symptoms. There's nothing you need to do. There's nothing wrong with you. This one little blood test can really make a huge difference.
Did the early detection save your life?
Yes, I believe it did.
Thank you. I look forward to working with all of my colleagues to advance this critical legislation behind what we are considering and discussing in this hearing today, This is a bipartisan issue that we can have significant impact on. Thank you, Mr. Chairman, and I yield.